canine mast cell tumor symptoms. Canine mast cell tumor MCT is a complex disease, and its symptoms-associated discomfort and treatment outcomes depend on the tumor's specific location and extent of spread. Here is a detailed description of the symptoms, discomfort, treatment, and recurrence rates for mast cell tumors in different locations. Symptoms and discomfort in different locations: skin and subcutaneous tissue. Symptoms: in the skin or subcutaneous tissue, mast cell tumors often appear as one or more firm masses. The surface of the mass may be smooth or ulcerated, and its size may vary, especially when manipulated or irritated. Discomfort. Possible symptoms include localized redness, itching, and pain. The dog may constantly lick, scratch, or bite the affected area, leading to further ulceration or infection. Internal organs such as liver, spleen, gastrointestinal tract. Symptoms. When mast cell tumors spread to internal organs, they can cause nonspecific symptoms such as loss of appetite, vomiting, diarrhea, and weight loss. Hepatomegaly, enlarged liver, and splenomegaly, enlarged spleen, may also occur. Discomfort. Involvement of internal organs can lead to significant abdominal pain, discomfort, and systemic itching, particularly when large amounts of histamine are released. Oral and mucous membranes. Symptoms. Mast cell tumors in the oral and mucous membranes may present as masses, ulcers, and bleeding. Difficulties in eating and swallowing can also occur. Discomfort. Common discomfort includes pain, bleeding, and difficulty in eating. Recurrence rate after surgery. Recurrence rate. The recurrence rate after surgical removal of mast cell tumors depends on several factors, including the tumor's location, size, completeness of surgical excision, and pathological grade. Generally, high-grade and incompletely excised tumors have higher recurrence rates. Studies indicate that completely excised low-grade mast cell tumors have a low recurrence rate, whereas high-grade tumors have a higher recurrence rate even after complete excision. Probability of systemic occurrence. Probability of systemic mast cell tumors. The likelihood of systemic spread metastasis of mast cell tumors is closely related to the tumor's pathological grade. Low-grade mast cell tumors usually remain localized, whereas high-grade tumors are more likely to metastasize to internal organs, lymph nodes, and bone marrow. The systemic occurrence rate for high-grade mast cell tumors can be as high as 30 to 50%. Treatment and prognosis. Treatment methods include surgical excision, chemotherapy, and radiation therapy. For localized tumors, surgical excision is the first choice. For recurrent or incompletely excised tumors, chemotherapy and radiation therapy are commonly used as adjunct treatments. Prognosis. The prognosis depends on the tumor's pathological grade, the completeness of surgical excision, and whether the tumor has metastasized. Low-grade tumors have a better prognosis, while high-grade tumors have a relatively poorer prognosis.